Okay, so we finish cleaning the cream from the lip, and we'll apply some cold pressing now. By the way, please note, her lips are standard European lips. The upper lip is always a little smaller than the lower one. The ratio between upper and lower lip height is approximately 1 to 1.6. If you would evaluate lips of a black person, usually they have even lips. Both of the volumes are the same. So for European, for Caucasian people, it's the best to inject more into the upper lip, and for people who have even lips, you can inject the same amounts of fillers. But variety is your choice. If you use normal amounts, safe amounts, and you know the techniques of injection, you can play with the volumes. Smaller amount is always better. You can always inject more if you want later, but it would be better if you don't need to melt the filler with hyaluronidase if the patient's expectations was to have smaller lips than you made. So knowing limitations is very important. Okay, once again, swiping with antiseptics, and I'll prepare the syringe. Filler is at the tip of the needle. All right, and our goal is to enhance this line, the border of the upper lip. For a very senior patient, if you have a, let's say, a 60-year-old woman who came for a lip injection, you can enhance the lower border as well, but this is rare. And I will start injecting. The goal of this injection is to make the edge of the upper lip more sharp, and you shouldn't over-treat this area. We will use approximately 0.1 for the whole border along the lip. Now I need to warn you that you shouldn't go above the border. You should go right in the vermilion border, not above. And as you can see, the edge is already sharper here. Now I will go to the most painful spot in the lip, which is called the Cupid's bow. A subtle amount of filler here too. Nope. We have some more bleeding, we can hold it. Sometimes you'll want to enhance the philtrum as well. Philtrum is a hollow under the nose, between the nose and the lip. By the way, we encountered some bleeding. That's not bad, it's not much. If it happens, don't be scared. Just push and hold for a while, for a couple of minutes. If you will happen to make a hematoma on the lip during procedure, there are two choices. You can withdraw doing the procedure totally and do it later, or then you need to trust mathematics, trust the gauge of the syringe. Don't inject from the eyes point of view, because once the hematoma will clear, you will have asymmetric lips. When you will be experienced, you won't be looking at the gauge of the needle. You will know exactly how much filler you put inside the tissues. But if you have something else ruining your symmetry, let's say some abnormal swelling or hematoma, you should know that the hematoma will disappear in approximately a week or two. And if you will make symmetric lips with a hematoma, it's logical that after the hematoma is healed, we will have asymmetry. And we just held it a little, and you see, it's not expanding. Good. Now we will continue with the border of the lip. And I'm I'm injecting straight at the border. don't grow the area of the lips. Do not inject above the border. And as you can see, we have injected only 0.1 ml. Do not over-treat the border of the lip. And you can see it already looks sharp and nice. Now, she also has a flat philtrum, and we want more accent to it. So now, I will enhance 2 lines right here. Can I have a pen, please? A black one? Right. This is the philtrum, this area, and I will be enhancing these 2 lines. You should use approximately 0.1 ml for this move. So 0.05 to each border of the philtrum. We are subcutaneously. We can try to aspirate, but I'm sure that we will not have any vessel, any big vessel present here. And I slowly start to inject. Well, already sharper. And next side. Nothing happens. See, I made one side a little more sharper. Voila. The philtrum now, the bump, is simply more sharp. Now we'll continue with the cannula to volumize the lip.